When you hear the words, "you have breast cancer," your world changes in an instant. The fear, the urgency, the overwhelming pressure to do something, anything, can lead to rushed decisions that may not be in your best interest. But here's the truth. Some of the most common mistakes in breast cancer surgery aren't about what's done. They're about what's done too soon, or without the full picture. As a cancer survivor, a seasoned oncologist, I've seen women make choices they later regretted, simply because they didn't know better. So today, I want to guide you through 15 breast cancer surgery mistakes to avoid, because you deserve clarity, confidence, and the best possible outcome. 1. Choosing surgery without a full diagnosis and staging. One of the biggest mistakes is rushing into surgery before all the facts are known. You need to understand your cancer type, size, hormone receptor status, HER2 expression, and whether it has spread. Without this information, even the best surgery might be the wrong move. Imaging like MRIs or PET scans and pathology reports from biopsies are essential for a safe and effective plan. Take the time to let your doctors fully stage the cancer first. Many women think that acting fast equals saving their life, but acting smart is what truly matters. Pushing for surgery before full staging can lead to unnecessary procedures or missed opportunities for better care. Your diagnosis is the map. Don't take the journey without it. Ask questions, get results, and make sure your team is on the same page. You have more power than you realize when you're informed. 2. Letting fear or pressure dictate the surgical choice. It's normal to feel scared, but fear should never make your decisions for you. Some patients choose aggressive surgeries out of panic, not because it's the best clinical option. Pressure from family, social media, or even physicians can also push you in directions that don't feel right. Remember, you are in control of your body and your journey. Let knowledge be your guide, not anxiety. You almost always have time to get clear answers and think it through. If someone rushes you, that's a red flag. You deserve space to breathe, understand your options, and move forward with peace of mind. Your courage lies in asking questions, not just saying yes out of fear. 3. Assuming bigger surgery means better results. More doesn't always mean better. Many women believe that removing both breasts or having more tissue taken out automatically leads to higher survival, but that's not always true. In early-stage cancer, lumpectomy with radiation often has the same survival rate as mastectomy. What matters most is clear margins and a treatment plan tailored to your case. Bigger surgery can also bring more complications and longer recovery. We tend to equate drastic action with safety, but surgery is about precision, not just removal. Breast cancer isn't one size fits all, and your surgery shouldn't be either. A well-planned, focused surgery can save your life and protect your quality of life. Always ask your surgeon, is there a less invasive option with the same benefit? Sometimes less is truly more. If you've made it this far, you're already taking charge of your health, and that's powerful. But we need your help to spread awareness. Please like this video and subscribe to our channel. We're on a mission to reach 100,000 subscribers this year, and we cannot do it without every single one of you. Your support helps us educate and empower others just like you. 4. Overtreating with a mastectomy. When a lumpectomy would suffice. Many women think mastectomy is the safer option, but that's not always true. In fact, for many early-stage cancers, a lumpectomy followed by a non-surgical treatment offers equal survival, with less physical and emotional trauma. Mastectomy is a major surgery that removes the entire breast, and it often requires longer recovery and more complex reconstruction. If your doctor says a lumpectomy is possible, it's worth serious consideration. Don't default to the most extreme option without understanding the facts. We often hear the phrase, "just take it all off," but cancer doesn't work that way. Bigger surgery doesn't always mean the cancer is gone for good. It's about targeting what needs to be removed while preserving as much of your body as possible. Trust the science, not just the fear. A breast-conserving approach can be both effective and empowering. 5. Ignoring genetic testing before surgical planning. Your genes can change everything about your surgical plan. If you carry a mutation like BRCA1, BRCA2, or PALB2, your risk of future breast and ovarian cancers is significantly higher. That might mean a double mastectomy is the smartest move, but if you don't test first, you won't know. Sadly, many women have surgery before testing and end up needing a second, more invasive procedure. Genetic testing should happen early, not as an afterthought. Even if you don't think you're high risk, it's still worth asking. Many women under 50 or those with family history qualify for free or low-cost genetic counseling. Knowing your mutation status isn't just about cancer prevention. It helps personalize your entire treatment. Don't skip this vital step. It could save you from regret later. Still with me? Great, because the next set of mistakes can seriously affect your recovery, appearance, and emotional healing. If you're facing surgery or helping a loved one through it, you'll want to hear this next part. These next mistakes are often invisible, but they can have lasting consequences. Let's keep going. 6. Not asking about sentinel node. Biopsy versus full axillary dissection. Many patients don't realize they have options when it comes to lymph node surgery. A sentinel node biopsy removes just a few key lymph nodes and is much less invasive than a full axillary dissection. This matters because removing too many nodes can lead to lifelong lymphedema, numbness, and arm swelling. In many cases, sentinel node biopsy gives the same results with fewer side effects, but if you don't ask, you might not even be told it's an option. Your surgeon should explain the difference clearly, but you should also feel empowered to ask, do I really need a full dissection? This one question can protect you from complications that impact your daily life. Lymphedema is no small issue. It can limit mobility, confidence, and comfort for years. Make sure your team is considering not just your cancer, but your future quality of life. 7. Skipping a second opinion before major surgery. You might trust your first doctor, and that's great. But getting a second opinion isn't about mistrust. It's about making sure nothing is missed. Breast cancer is complex, and different doctors may offer very different treatment options based on the same diagnosis. Sometimes a second opinion can lead to a less invasive, more effective, or more up-to-date approach, and most insurance plans cover it. Don't feel like you're being disloyal by seeking another voice. It's your right. You're not just fighting cancer, you're fighting for the best path forward. A second opinion gave me the clarity I didn't know I needed. Sometimes it confirms what you already knew, and sometimes it opens new doors. Either way, you win. 8. Not considering reconstruction. Timing or type carefully. Many women assume reconstruction should happen immediately, but it's not always that simple. If you're planning to have radiation therapy, it can affect the healing and appearance of reconstructed tissue. Some patients benefit more from delayed reconstruction, which allows your body to heal before undergoing another major procedure. Others might opt for no reconstruction at all, and that's okay too. What matters most is that you make the choice with full awareness. Reconstruction should be discussed before your first surgery, even if you're unsure. Planning ahead protects your future options and gives you peace of mind. Don't let anyone rush you into immediate reconstruction unless you fully understand the pros and cons. You have the right to choose what feels right for you, physically, emotionally, and spiritually. It's your body, and your voice matters. 9. Underestimating the emotional and psychological impact of surgery. Surgery is not just a physical event. It's an emotional journey. Losing a breast, changing your appearance, or even just going under anesthesia can leave you feeling vulnerable, confused, and overwhelmed. Many women are surprised by how much grief, anxiety, or even shame they feel after surgery. That's why emotional preparation is just as important as medical prep. Support groups, therapy, and honest conversations can help you process what's coming. It's okay to feel sad or angry. It doesn't mean you're weak. Don't suffer in silence. Ask your medical team about resources for emotional support before and after surgery. Healing is not just about stitches. It's about rebuilding confidence and connection to yourself. Your heart matters just as much as your body. 10. not including a plastic surgeon in initial discussions. Even if you think you won't want reconstruction, talking to a plastic surgeon early is essential. They can help your surgical team preserve important tissue and skin that might be needed later. Once tissue is removed or scarred, your options can be permanently limited. A 30-minute consult could give you freedom of choice down the road, even if you never use it. It's about planning smart and protecting your future. Many patients assume reconstruction is for later, but smart surgeons plan for later now. Even if you're leaning toward going flat, it's still worth the discussion. A plastic surgeon is not just cosmetic. They're part of the complete cancer care team. One conversation now can save you heartache later. Be proactive. Your future self will thank you. 11. Choosing surgeons or hospitals. Without breast cancer specialization. All surgeons are not the same. Breast cancer surgery requires special training, experience, and a team approach. Choosing a general surgeon or a small clinic may increase your risk of complications, incomplete removal, or cosmetic issues. High-volume cancer centers tend to have better outcomes and access to more advanced care. Don't settle for good enough when your life is on the line. Ask, how many breast cancer surgeries has this doctor done? Do they work with a full team? Oncologist, radiologist, plastic surgeon, pathologist? You want a center that lives and breathes breast cancer care. You deserve a team that doesn't just treat cancer, but treats you like a whole person. You're not just a case. You're someone's mother, sister, daughter, friend. 12. Delaying surgery too long, due to indecision. It's smart to think things through, but waiting too long can be risky. Most early-stage cancers allow for a 2 to 4 week decision window, but beyond that, the tumor could grow or spread. Sometimes fear, confusion, or just too many opinions keep patients stuck in limbo. Don't let indecision paralyze you. Make a timeline, write down your questions, and get help organizing your next steps. Delaying treatment can lead to harder surgeries, more aggressive treatments, and lower chances of full recovery. Take the time you need, but not so much that you lose ground. Balance courage with action. Ask your team, how much time is safe for me to consider my options? Then take that time wisely. 13. Failing to review the surgical pathology report thoroughly. After surgery, your pathology report tells the real story. Whether the cancer was completely removed, how aggressive it is, and what's next. But too often, patients never see it or don't understand it. Don't leave that information in your doctor's hands alone. Ask for a copy. Ask them to walk you through it in plain language. This report shapes your next steps, including whether you'll need radiation, chemotherapy, or hormone therapy. Some patients find out weeks later they had positive margins or missed lymph node involvement because no one explained it clearly. Don't let that happen to you. Make this part of your recovery plan. Knowledge is power, even after surgery. Don't move forward blind. Get the full picture. 14. Overlooking clinical trials or new surgical techniques. Clinical trials aren't just for rare cases. They may offer cutting-edge options with fewer side effects or better cosmetic outcomes. Some trials focus on nipple-sparing mastectomy, improved reconstruction materials, or new imaging techniques that reduce unnecessary surgery. But many women miss out because no one tells them about it. You need to ask directly, are there any clinical trials I might qualify for? Don't assume it's not for you. Trials are often open to patients at all stages, and many are funded so cost isn't an issue. They also give you access to top-level care and extra support. Don't let fear of the unknown stop you from exploring everything available. You might be helping future patients as well as yourself. Be open and be curious. 15. Not asking for a multidisciplinary team review. Your case should never be managed by one doctor alone. A tumor board brings together oncologists, surgeons, radiologists, pathologists, and plastic surgeons to review your case and recommend the best plan. This approach reduces mistakes and ensures no angle is missed. Sadly, many hospitals don't do this unless you ask. Make sure your treatment plan has had multiple expert eyes on it. Even a great doctor can miss something without collaboration. Cancer care is complex, and teamwork saves lives. Don't be afraid to ask if your case was presented at a tumor board. If it wasn't, ask if it can be. You deserve comprehensive, team-based care. If this video helped you feel more prepared and confident, please give it a like and share it with someone you care about. And if you haven't subscribed yet, what are you waiting for? We're trying to reach 100,000 subscribers this year, and your support means everything to us. Join our growing community focused on healing, hope, and smart decisions. Thanks for watching. Stay strong, stay informed, and stay empowered.